Good morning from Tongva and Chumash lands, also known as Los Angeles. My name is Bonnie Madura, Strategic Implementation Lead here at the California Endowment. I'm excited to welcome you all and be your moderator for today's Policy Perspectives webinar, The May Revise, HR1 and the Future of California's Safety Net. I have a few housekeeping items before we get started. First, this webinar is being recorded, and the recording and any slides presented today will be shared with all registrants after the event. Second, we encourage you all to engage in today's conversation and submit any questions you may have using the Q&A box at the bottom of your screen. We'll do our best to answer as many of them during the audience Q&A portion of the program. We also want to thank those of you who took the time to submit questions in advance. They helped shape today's program. Policy Perspectives is a virtual space for conversations on state and federal policy issues that impact our state and communities. These webinars are nonpartisan and non-political, and they are intended for informational purposes. Over the past year, we have seen major developments at the federal and state levels that are impacting access to healthcare and safety net programs. Governor Newsom's May Revise has sharpened the conversation about California's fiscal outlook and the difficult choices facing policymakers, particularly as the changes from HR1 are being implemented. And of course, we are meeting just after the primaries in California, which offer another reminder that the policy landscape continues to evolve. In the coming months, voters will be considering contrasting visions and conversation about the future of healthcare and the state's broader policy priorities. Election results, budget negotiations, and policy decisions are all converging in ways that will influence the resources available to families and communities in California for years to come. Against this backdrop, today's conversation is about more than numbers, budgets, and policies. It's about what these decisions mean for real people in our communities. It's about whether families have access to food, whether Californians can access healthcare, and whether our public systems can continue to support individuals in times of economic uncertainty. During today's webinar, our speakers will help us unpack the May revision, examine the multiple implications of HR1, and explore what these developments could mean for California's safety net. I'm now thrilled to introduce our speakers and partners. I will not go into their full bios, but we will be sharing them in the post-webinar resources. First, we are excited to have with us Adriano Ramos Yamamoto, Senior Policy Fellow at the California Budget and Policy Center. Adriana will provide an overview and highlights of some key areas of the governor's May Revise. She will be followed by Corey Rosella, Executive Director of the Western Center on Law and Poverty. Corey will discuss HR1 and the intersecting budget and policy conversations taking place in Sacramento. We will then be joined by Carlos Marquez III, Executive Director at the County Welfare Directors Association. He will provide a perspective on impacts at the county level and opportunities to mitigate harms. Last but certainly not least, we will hear from Vanessa Terran from the Mixteco Indigena Community Organizing Project. They will share about some of the impacts on immigrant communities. I will now walk you through the flow of today's program. After we hear the opening remarks of our speakers, we'll invite everyone back on screen for a panel discussion. After the panel section, we will have time for audience Q&A. So again, I'd like to remind you to please enter your questions in the Q&A box. With that, let's get started with the program. Adriana, I will turn it over to you.
Thank you, Bonnie. Good morning, everyone. Thank you for having me for this important and timely conversation about the state budget. I do have a set of slides. Thank you so much. And just in case you're not familiar with the Budget Center, we are a nonpartisan research and analysis organization working to create a just and equitable California where all communities have the resources that they need to thrive. Next slide, please. Today, I'm going to do a few things over the next 15 minutes or so. I'm going to share our key takeaway on the governor's May revise. I will provide a big picture overview of the revised budget. I'll talk about some proposals specifically impacting Medi-Cal and CalFresh, as well as preview what to expect next. And starting with the big picture overview on the next slide. The May revise includes common sense revenue solutions, but makes affordability challenges worse. And it also fails to fully protect Californians from harmful federal cuts. Next slide. I want to share some top lines on the May revise. So, on the bright side, the governor's revised budget reflects stronger than anticipated revenues, and it also includes a couple of common sense revenue solutions. But having said that, we do have some concerns with the governor's approach. He largely fails to protect communities from the harm of massive federal cuts that are required by HR 1, which President Trump signed into law last year. And he also makes it harder for Californians with low incomes to access basic supports. And he fails to propose more substantial ongoing revenue that is needed to protect vital services and respond to the growing needs of Californians. So let's now turn to some of the details, starting with the governor's positive revenue forecast and what it means. So the revised budget projects that general fund revenues will be almost $17 billion higher across the 3-year budget window compared to the January forecast. That's largely driven by a strong stock market. And also want to note that budget window refers to the prior fiscal year, the current fiscal year that we're in, and the upcoming fiscal year that begins on July 1st. More revenues are always a good thing, but we need to keep in mind that most of these revenues are actually already spoken for because of requirements that are in California's constitution. There's Prop 98, which requires a lot of this revenue to go to K through 14 education. And in fact, because of strong revenue growth over the past year, spending for education is up by over $6 billion since January and is up by over $20 billion since last June. Another chunk of the additional revenue identified by the governor will automatically be split between the state's rainy day fund and certain debt payments that is required by Prop 2. And the additional revenue deposit will bring the rainy day fund balance to around $15 billion next year. The governor uses the rest of these unexpected revenues to help build a $10 billion cushion for the 2027-28 budget. And that's the budget for the fiscal year that will start a little more than a year from now on July 1st, 2027. Let's now turn to some of the concerns that we have with the governor's approach. Overall, as I mentioned earlier, the May revise fails to respond in a meaningful way to HR 1 and ultimately makes it harder for people with low incomes to access basic supports. We know that Californians face many challenges today, including with rising costs. And given this reality, state leaders shouldn't make things worse and make it even harder for Californians to make ends meet. Unfortunately, the governor's plan moves in the wrong direction across a number of policy areas that I won't go into fully in the course of this presentation, but we actually do have a full report on our website in case you're interested in taking a look at that. But the governor says that these policy choices are necessary to help address California's budget challenges. Going on to the next slide. So want to mention that the governor's May revise doesn't include a plan to address all of the federal threats that we're seeing. And it creates more barriers to Medi-Cal, especially for immigrant Californians. It provides inadequate funding for counties and food banks to mitigate the harms that we see to CalFresh. And I also want to note that the legislative leaders they are also coming up with their own budget proposals, and they actually include more funding and delays, cuts to Medi-Cal, which is encouraging to see. So we do think that the governor and the legislature should work together to protect those programs. Let's go on to the next slide. The May revise fails to address the affordability crisis, proposes cuts to in-home support services, It walks back commitment to new child care spaces and provides no new investments to increase affordable housing and address homelessness. So just wanted to mention those very briefly. And I also want to talk next about revenues. California's budget challenges, if we could go to the next slide. They're real, but they're rooted in an outdated revenue system. And I think this point is really important to mention. To put it in another way, California has a revenue problem. Our current tax policies don't sustainably generate the revenue that's needed to keep up with the cost of maintaining critical services, to help mitigate the impact of federal cuts, or to support the investments that are really overdue to ensure that all Californians can make ends meet. In fact, most of the state spending growth since 2019, according to the LAO, was just to keep up with rising costs like inflation in order to maintain existing services. So, all that to say, addressing a revenue problem requires revenue solutions. And I want to expand on that a little bit more on the next slide. Oh, actually, we do want to give the governor credit for advancing a couple of meaningful ideas to modernize California's tax system. So there's a few proposals that I included here on this slide. These proposals would raise over $1 billion in new revenue in the next fiscal year and about $2 to $3 billion annually after that. And I'm just going to hit the highlights of these proposals here. One of the proposals from the governor is to tax some currently untaxed software purchases made by businesses and individuals. This new sales tax would apply to software that's downloaded or accessed online. And we think that this is a reasonable step towards modernizing the tax system for an increasingly digital economy. And the governor's second proposal is to permanently limit corporations' use of tax credits. The annual limit would be either $5 million or 50% of a corporation's tax bill before applying the credits, whichever is higher. This proposal would reduce the number of corporations that pay next to nothing in corporate taxes in California, which is a huge problem. I want to talk a little bit more about this on the next slide. As you can see in this chart, and looking specifically at the yellow part of each of the charts, well over 40% of profitable corporations only pay the 800 minimum tax in California because they're able to use tax credits and other mechanisms to cut essentially what they owe. And going on to the next slide, if we look at the roughly 340 corporations with profits above $100 million, we see that on the blue portions of this chart, that almost a quarter of these corporations use credits and other methods to cut their tax bills at least in half. And of those, around 20, represented in the light blue portion, were able to nearly zero out their tax bill. So permanently limiting corporations' ability to use tax credits, as the governor proposes, would go a long way toward addressing this problem. Next slide. Despite these good proposals, additional revenue solutions are needed to meet Californians' growing needs and blunt the harms of federal cuts to healthcare and food assistance. And one idea that we have is to stop giving corporate tax breaks a free ride. They essentially fly under the radar every year and rarely get a second look. And we also think that corporate tax breaks should be evaluated, just like spending for childcare, healthcare, housing, and other critical services. Consistently evaluating corporate tax breaks can help to assess whether they're serving their intended purpose and inform options for longer-term changes. Another idea we have is to close the water's edge loophole, which we've been talking a lot about this year. This change would essentially stop multinational corporations from using offshore tax havens to avoid paying California taxes. This would generate up to $3 billion per year to support services for California's communities. And so these are just a couple of recommendations. Going on to the next slide. We believe that state leaders must respond more boldly to the challenges that Californians are facing. It's true, as the governor does like to point out, that our state's economy is one of the strongest in the world. But there are too many people that are still left behind, and state leaders have options to make corporate taxes more fair and raise more revenue. We know that the budget plan released by the state Senate and the Assembly includes some proposals to raise revenue, which shows that the governor's approach isn't the only way. And the key question that is facing state leaders at the moment, as they move forward to finalize the state budget, is will California's prosperity be used to protect communities, or will policymakers continue to prioritize corporate tax breaks over people's needs? And we're just a few weeks away from finding out. So I do want to now talk more about Medi-Cal and CalFresh, and I know Corey is going to talk about these programs as well. So I just want to hit the highlights here, starting with Medi-Cal. On to the next slide. Thank you. So we talked about HR1, and I do want to note that the governor's May revise does reflect the impacts of the harmful federal policy changes that are required under HR1. Specifically, the administration projects that about 44,000 people will lose Medi-Cal coverage in 2026-27, growing to roughly 1.3 million people by 2029-30 because of HR1. And it's worth pointing out that many people could lose coverage even if they are still eligible, simply because of paperwork burdens or difficulty navigating the system. So the May revise begins implementing some of these federal changes, including work requirements, more frequent eligibility checks, reduced retroactive coverage, and restrictions affecting immigrant eligibility. And I'm going to talk more about proposals specifically impacting immigrant Californians on the next slide. Here, we did see some very harmful proposals, specifically impacting immigrant Californians at a time when we know that immigrant communities are already facing growing threats and instability because of this hostile federal immigration policies. Specifically, we see higher Medi-Cal premiums proposed for certain immigrants ages 19 to 59, increasing monthly costs from $30 to $50 beginning in July 2027, which could make coverage even harder to afford for low-income families that are already struggling with the cost of living. We also see the governor proposing to apply work requirements to immigrants enrolled in state-funded Medi-Cal, even though there's no requirement to do that. There's no federal requirement to do that. And the governor also proposes to delay but still end full-scope Medi-Cal for immigrants with humanitarian status. This is because of HR1 that would leave 200,000 refugees, asylees, and other vulnerable community members with only restricted scope Medi-Cal, and that essentially refers to emergency services or pregnancy-related services. Next, I want to highlight some proposals impacting seniors and people with disabilities. This is another one of the more concerning proposals in the revised budget. It proposes to reinstate strict Medi-Cal asset limits beginning January 2027. So capping savings and assets at just $2,000 for individuals and $3,000 for couples, which would essentially punish modest savings and could force older adults and people with disabilities to spend down the little financial stability that they have just to maintain access to health coverage and long-term care services. The budget also includes cuts to in-home supportive services and lower payment rate caps for PACE programs. That's the program of all-inclusive care of the elderly. I want to move next to provider taxes because they are a major source of funding for Medi-Cal and hospitals across California. The May revise proposes a new MCO tax beginning January 2027. And I can't get into all the details here because I do want to move on to the panel discussion, but it includes one component that's similar to the current tax and compliant with Prop 35, and another structured differently and not subject to Prop 35. The administration does estimate that the new structure would generate substantially less revenue from the current tax. And on the hospital fee side, federal approval is still pending for our revised waiver request for the hospital fee program. And want to briefly touch on food assistance and just acknowledge that May revise falls really short in preparing for CalFresh cuts. including inadequate funding for local food banks, so that there's 30 million one time, and that's a decrease from the annual 60 million that the program has previously received. We also see 30 million one time to support counties' additional workload due to expanded CalFresh time limits, and that's definitely not enough in terms of what counties are anticipating to spend on implementation in the coming year to implement all of the requirements under HR 1, and I'll let Corey and others speak to that a little bit more. And lastly, I want to mention that the CFAP, the California Food Assistance Program, has been maintained. This expansion will broaden the reach of the program by including all income eligible Californians ages 55 and over. This is a great first step, but we do know that under HR 1, many people will become ineligible or face new barriers, jeopardizing their food benefits. And with that, I want to close by mentioning just a couple of things, some next steps in the budget process on the next slide. We are now in the fastest part of the budget process. We're going to see a unified legislative budget soon from the California Assembly and Senate. By June 15th, the legislature has to pass the unified legislative budget. And then in late June, the governor and the legislative leaders reach a budget deal, after which the governor typically signs the bills in the budget package, possibly with any line item vetoes. And in August, from there, we will see some revisions to the budget. And I also want to mention on this next slide, we have a budget academy that includes more tools and resources on the state budget. And with that, I will pass it back over to Bonnie. Thank you so much.
Good. Thank you, Adriana, for that comprehensive overview. I'm now going to welcome Corey from the Western Center to join us. Hi, Corey, welcome.
Hey.
So let's talk about HR 1. We've had various conversations about it through this forum in the past year, but as the state continues to grapple with implementation, and as we just heard from Adriana, there are many policy and budget decisions still on the horizon. I'm hoping you can highlight for us some of the differences between what is in HR 1 and how budget policy decisions may exceed the already expected harms of HR 1.
Thank you, Bonnie, and good morning, everyone. I'm Corey Rosella, Executive Director of Western Center on Law and Poverty. At Western Center, we've been fighting for racial and economic justice for low-income Californians in the courts and the legislature for nearly 60 years. As Bonnie mentioned, I want to talk today about how the May revise exacerbates the provisions of HR 1 and in some cases goes even further than what HR 1 requires. And just as a reminder, HR 1 is the so-called One Big Beautiful Bill Act, which was passed in July 2025. But there are many provisions that roll out over time. So we want to make sure that we understand what is happening and when. HR 1 represents the largest cut to Medicaid and SNAP in each program's history to pay for tax cuts for corporations and the ultra wealthy. And it's difficult to overstate what the impact that the dual crises of the state budget and HR 1 will have on millions of Californians. Both the federal government and California are cutting food benefits and health coverage to save money. As I mentioned, HR 1 cuts $1 trillion from Medicaid and nearly $200 billion from SNAP nationally over the course of a decade. Combine that with the measures in the state budget, which impact low-income immigrants in particularly, 3 million Californians are projected to lose Medi-Cal, and Californians' uninsured rate will nearly double by 2030. So both federal and state policy sells this as budget savings on paper, but that means dire things for people in real life. People still need prescriptions, people still need to eat. Cutting the programs doesn't cut the need. If we go to the next slide, there is a lot of information on this next slide, and the slides will be sent out, and I hope you take the time to read it later. We will also include with the materials Western Center's timeline of HR 1's health cuts. So HR 1 has two main features, which Adriana touched on, to use administrative hurdles to make it harder for people to keep Medi-Cal. They are work requirements and requiring eligibility renewals twice a year instead of annually. But the governor takes these administrative barriers further and applies it to Medi-Cal recipients who have state-funded Medi-Cal, which are primarily immigrants. Work requirements and more frequent renewals have proven to exclude eligible individuals simply because the paperwork burden is too onerous. The federal interim final rule for HR 1 requirements was just published this week for comment. And beyond these bureaucratic hurdles, there are targeted cuts to immigrant coverage. HR 1 cuts federal funding for certain immigrants like refugees, asylees, and trafficking survivors. Long-standing and unchanged federal law allows states to cover immigrants in these categories that don't have federal funding. California could cover this group with state dollars as it has done for decades, but it's not going to. And according to the May revise, and it's only going to delay the implementation. As a result, 200,000 people will get shifted to restricted scope Medi-Cal. I won't go too far into the asset limits, but HR 1 does not require any changes to asset limits for Medi-Cals. And a few years ago, Western Center and many other organizations were able to get rid of the Medi-Cal asset test for older adults and persons with disabilities. And last year's state budget saw the return of an asset limit. And this year we see an even more drastic proposal to cut the asset limit. And then I want to make a note, premiums are not required by HR 1, and as Adriana mentioned, we are looking at an increase of monthly premiums for state-funded immigrants on Medi-Cal. But I do want to add a distinction here, which is not on the slide. In October 2028, HR 1 will require a co-payment of up to $35 per visit for Magi enrollees above 100% of the federal poverty level. So we know copay is different than a premium, so that will be another thing on the horizon. Next slide. Last month, UC Berkeley Labor Center and the UCLA Center for Health Policy Research issued a report showing how state and federal policy choices are devastating low-income communities and Black and Brown Californians by 2030. In just 3.5 years, low-income Californians under 200% of the federal poverty line will go from a 9.4% uninsured rate to nearly 24%. And nearly every racial group sees their uninsurance rate double. But it should be noted that while white Californians will go from a 4% to 8% uninsured rate, Black Californians will be at 14%, and Latinx Californians will be at 20% uninsured rates. There's also geographic disparity. Los Angeles and Inland Empire counties will see uninsurance rates above 16%. And we know what this world was like when immigrants were excluded from Medi-Cal coverage, when our uninsurance rates were this high. We are being dragged back into the bad old days before Health for All and the Affordable Care Act. Next slide. I want to go quickly into some of the CalFresh and SNAP portions of HR 1. The same dynamic plays out with food. HR 1 delivers the largest cuts to federal food benefits in SNAP's history, over $187 billion over the next decade. And the California Mayor's Revise does not fill the gap. HR 1 imposes a 3-month time limit on CalFresh benefits for adults ages 18 to 64, and it eliminates longstanding exemptions for veterans, foster youth, and people who are unhoused. More than 500,000 Californians are at risk. It also, immigrants with humanitarian statuses started to lose benefits already on April 1st. And like in state-funded Medi-Cal, California has a long history of using state funds to cover food benefits, where the federal government is not providing funds, but it is uncertain whether that will happen here. There's also changes happening to the standard utility allowance, and counties are being asked to absorb massive new administrative costs because HR 1 cut the amount of federal funds to administer SNAP benefits in half. Okay, next slide. So as we know, some of this is already happening. There are federal rules that are coming out to implement HR 1. There are delayed timelines in HR 1. At the same time, our state budget process is working its way through the system. Thousands of Californians are getting less or no access to food benefits. The Medi-Cal enrollment freeze for undocumented adults is in effect, and a recent report showed that 86,000 undocumented immigrants have already left or lost Medi-Cal in January and February. And I want to leave you with this thought. Both Sacramento and Congress are cutting healthcare and food assistance to save money, but people still need prescriptions. People still need to eat. We are watching the world before Health for All and the ACA come back. And this is both because of a federal mandate and the choices we make in our state budget. With that, I will turn it over back to Bonnie.
Thank you, Corey. I'll now welcome Carlos from the California Welfare Directors Association to join us. Hi, Carlos. Welcome. So, as we know, counties are on the front lines of HR 1 implementation. Can you share some of the impacts you are already seeing at the county level and what decisions need to be made through the state budget and at the county level to mitigate the harms of HR 1 on Californians?
Thank you so much, Bonnie, for the invitation, and good morning, everyone. It's great to be with you. So as you heard from my panelists and previous speakers, counties are really managing some pressures on both ends. We are dealing with new administrative cost shifts, and at the same time, the federal government is reneging on previous commitments in terms of share of costs for what it takes to actually operate CalFresh in particular. I think it's important just to level set that SNAP, CalFresh in California, and Medi-Cal, known as Medicaid federally, these are federally mandated, state supervised, and county administered programs, meaning that it's an intergovernmental partnership. And when one partner steps back from their obligations, it has significant downstream impacts on the entire safety net, which is what we're managing against as we speak. I think it's important to note when we think about the impacts that are unfolding on the ground at the county level with regard to HR 1 implementation, we are really facing a slow-moving hunger and uncompensated care crisis. And that's largely because California, unlike other states, has chosen to implement HR 1 changes at a different schedule than we've seen in other states. Take CalFresh, for example. The Department of Social Services has taken a fairly thoughtful approach to implementation, choosing to implement these new work requirements, so-called work requirements within CalFresh, beginning June 1st, which just passed. And some states actually implemented upon enactment or shortly after HR 1 was actually enacted, July 4th of last year. The state did that because they recognized that moving too precipitously with implementing massive new complex policy changes could potentially dramatically increase the state's error rate, which has downstream consequences for our state budget if it goes too high. And also that the state recognized you could implement a more thoughtful harm reduction approach with more time built into the implementation. So that's really, I think, a point I want to emphasize. In some ways, the state is doing their level best to mitigate harm. On the Medi-Cal side, the Department of Healthcare Services has also taken great pains to issue preliminary guidance to counties for how we might think about implementing these new changes within Medi-Cal, and choosing not necessarily to wait until we get final guidance from the Centers for Medicaid and Medicare, which have been trickling out this week. That's actually put counties in a better position to try to prepare for these major changes. So in some ways, the state is, I think, trying to set counties up for success, so to speak. But in other ways, we have been really clear that the administration is really falling short in terms of meeting the moment. You heard some of the proposals that were included at the May revise to help stabilize county budgets and account for the doubling of workload that will be required for counties to implement HR1 responsibly in both CalFresh and Medi-Cal. And it's simply inadequate what we saw in terms of response to HR1 in the May revise. We're seeing a one-time workload funding proposals, which are woefully insufficient when we think about having to hire permanent full-time positions on an ongoing basis. It's woefully insufficient in terms of only funding about 30% of the workload that we know we will need to absorb in order to implement HR1 responsibly. It's also, I think, important to remember what tools counties have at our disposal to mitigate harm. We and the state are aligned, at least in principle, in trying to reduce program drop off as much as possible. And it is true, work requirements have done nothing more, and the evidence shows in every state where work requirements have been implemented, they do nothing more than push people off of benefits, especially when they are not implemented with adequate administrative capacity. But we and the state have said from the beginning that our goal is to use the levers we have at our disposal to keep as many people enrolled in Medi-Cal and connected to CalFresh as possible. And that ultimately means that we need to be able to review robustly for exemptions. It's going to require one-on-one conversations between clients, enrollees, and workers to ultimately be able to certify an exemption that may otherwise not be visible. Maybe the client didn't disclose a condition or a life circumstance in a form, or was ultimately unwilling to share that information at the beginning of the intake process. And so through successive conversations that build trust between workers and clients, that's really the only way that we're going to be able to learn that someone might be struggling in CalFresh recipient with domestic violence in the home. And if that's keeping the individual from being able to attain employment and meet these work requirements, that could potentially be certified as an unfit for work exemption within CalFresh. Within Medi-Cal, it's important for us to know, even not having an actual medical record or a doctor's note from someone who is unhoused, for example, that they may be struggling with a disability that hasn't been diagnosed or stopped short of a total disability. These granular level of details will only really come out if counties have adequate administrative capacity to hire enough well-trained and well-supported workers to have these conversations that will ultimately help us exempt as many people as possible. And of course, the other lever is to navigate those who are not exempt through the procedural hurdles that we know are designed to push people off of benefits. So we need to make sure that we have enough workers who are there to support the care and feeding process of making sure people have completed their paperwork and doing so timely. The reality is a lot of people will lose coverage and food assistance because they simply were not able to return a form on time, not because they are ineligible on paper, which is why the number of workers and the number of hours that we're able to devote to each case absolutely matters. So that's really been our focus in the legislature, is to fight for the proper amount of funding necessary to hire at least 24 new eligibility workers statewide to implement HR1 responsibly. Even as counties are dealing with some of the additional cost pressures, cost shifts that you've heard about already this morning, we are seeing counties take innovative steps to prepare for implementation to the extent possible. Within Medi-Cal, counties are forging new data sharing agreements with their managed care plans so that there's a seamless sharing of information about Medi-Cal enrollees so that our managed care plan partners can help us alert enrollees well ahead of their required redeterminations that they're coming up, so that our managed care partners can help notify actual providers and physicians of when someone is at risk of losing coverage. We also know on the CalFresh side that counties are working actively with their community-based partners, trying to set up new workfare programs so that if someone isn't able to meet their required hours through employment, they might be able to meet their required hours through volunteer or community-based participation. And we are even seeing counties explore reclassification of their worker roles. We know that largely eligibility workers have been focused on task-based work pre-HR1, but we need to transition our workforce to being, frankly, much more akin to social workers because they do need to be able to have fairly sensitive conversations with individuals who have a level of complexity that maybe was not as important to identify pre-HR1, that it's critically important now that we build as a core competency within our workforce. So these are some of the ways in which counties are preparing. I will say I'm heartened by the response that we're seeing, in the legislature. It certainly feels like both houses are hearing the message that it's table stakes to have enough workers to implement these new changes responsibly. That's the most cost efficient, upstream, and proven intervention that we can possibly fund as a state if we want to be able to mitigate an uncontrolled hunger and uncompensated care crisis. And so we've seen now in both houses proposals to partially or fully fund the workload that we believe is necessary to implement, at least within the first year. And as those negotiations are ongoing, we hope that we will have adequate funding in the two-party deal, and then ultimately that the legislature will have the leverage that they need going into negotiations with the administration to ensure that counties have funding necessary to implement responsibly. And I will go ahead and turn it back over to you, Bonnie.
Good. Thank you, Carlos. Let's now welcome Vanessa from MECOPE. Vanessa, please join us.
Yes, thank you so much, Bonnie.
Great. Hi, Vanessa. As has been noted, immigrants in California are experiencing compounding impacts from federal and state level policy and budget decisions. What are some of the impacts you're already seeing at the local level, particularly in the communities that MECOPE serves? And how are local communities organizing to mitigate these harms?
Mm-hmm. Well, thank you so much. Buenos dias. Good morning. My name is Vanessa Teran. I'm honored to have the opportunity to be here today on behalf of MECOPE, or Proyecto Mixteco Indígena. Just a little bit to understand who MECOPE is, or Proyecto Mixteco Indígena. We support, aid, organize, and empower the indigenous migrant community on California's Central Coast. We were founded in 2001 in one of the county's ambulatory clinics, known as Clínica Las Islas, by family nurse practitioner Sandra Young, who just recently passed on and just want to honor her life and legacy for bringing MyCOP into fruition. We've been around for 25 years since our inception in Ventura County. In the last few years, we've been expanding to other areas in the Central Coast, most specifically around Santa Barbara County, and most recently San Luis Obispo County. Thank you for the love to Sandy. Together with the state and county partners, we've helped people navigate our Americanized bureaucratic systems, the legal, the educational, healthcare access systems, access to food and shelter. We've been able to create and deliver mental health and well-being programs that are rooted in Indigenous practices, some of the first of its kind probably in the state. We support survivors of domestic violence and address public health issues. And we also work to recover from natural disasters, and most recently, the pandemic. And now, in recent months, we're enduring unprecedented immigration enforcement. All this while we're trying to maintain Indigenous roots, beliefs, and culture in a system that wants to dismantle our heritage and our ancestral knowledge. And so I want to thank you, all of you who are here, the almost 800 attendees today, for allowing us to share during a time that we're hearing and seeing our families and our neighbors being taken away from us. But not only this, we're facing brutal cuts in access to life-saving care in our healthcare system with the impacts of HR 1 and the recent shifts within our California Department of Healthcare Services and our public healthcare system. When federal policy changes cascade down to the state, what we end up seeing on the ground are deep ramifications, not only on the lives of those who will be impacted, but also on the entire healthcare system, which is in essence an ecosystem that sustains humanity, that sustains us as a people. And so when we talk about how we're trying to mitigate these changes, I want to start off with a little bit of a story. In the fall of 2025, we saw the initial repercussions of HR 1 in one of our counties, where we found out through a local county press known as the Santa Barbara Independent that one of our counties started to prematurely want to transfer UIS patients out of our local county healthcare system. But we immediately organized via local efforts between labor unions in the Central Coast, pro-immigrant organizations, and healthcare advocacy organizations to urge the county to halt its proposal to no longer serve patients based on their immigration status. To top it off, during that time, the enrollment freeze was going to happen in 2026, hadn't got into effect yet. And we saw it initially, obviously, as it enables a regression and a rollback of a decade of work of healthcare access and coverage for Medi-Cal for undocumented adults over the age of 19. And now we see, I believe, in actuality, a major setback which denies life-saving cares to thousands of Californians. So we're now advocating in the state legislature by bringing community stories of Medi-Cal recipients themselves traveling to Sacramento to share their stories with legislators on what would happen to them based on these impositions, based on these racially implicit policies that if they fall out of Medi-Cal by not being able to renew on time, or by simply being taken out of a healthcare system based on where they were born, what the degree of danger that is for an individual and a family and a community. And so these upcoming medical changes, as you know, Carlos delineated, would impose unaffordable monthly premiums exclusively on folks who are considered non-citizens, and it would eliminate essential services. Most recently, right now, we're trying to mitigate by actually doing extensive outreach on education, on dental services ending soon for undocumented populations. What we're doing essentially is sending out and deploying health navigators or promotoras and promotores, and a huge shout out and gratitude to promotores who are doing the work on the ground, community health workers and organizers who are educating our public to enroll, to continue their enrollment, to continue turn in their paperwork so that they maintain their health care. In the last winter and in the fall of 2025, we did extensive outreach on the ground in the fields, in panaderias, in laundromats, in schools, in open houses to get the word out to enroll before the enrollment freeze took into effect. We enrolled the most vulnerable of community members in our Central Coast, which are Indigenous farm workers who earn an average of $25,000 to $30,000 a year to be able to, just to get by. To address the impacts of policy changes, we've been doing clear and intentional communication and messaging that is culturally and linguistically accessible. So there's a lot of education out there. There's a lot of flyers, but we really need to make sure that education is empathetic, compassionate, respectful, that the community members actually engage in stories and in conversation, to reach out in schools and in what is considered ethnic stores. One famous one that people might know is Vallarta, for example, a local one, lavanderias or laundromats, panaderias, agricultural fields, churches, and community events like our local food markets. And so through our current work, our health navigators and all the health navigators in this space are really encouraging individuals that are eligible for full scope to take advantage of all the benefits such as dental services while they remain accessible. We're also beginning to inform community members about the changes, but we've decided to mitigate the harm and the fear that these policy changes are explicitly feeling through our community is by going by phases. There's a timeline of the rollout of these policies, and if you give everybody the bad news ahead of time, people are going to say, not for me. And we're already seeing that. So instead, we are ensuring that we're passing it as the policies roll out and make sure that the engagement is one-on-one in community. And we're also working with our local managed healthcare systems, such as Gold Coast Health Plan and CenCal in our local Central Coast, to educate, support, and advocate. And so we also believe that in order to mitigate, we have to create coalitions. Coalitions are essential during this time so that we're all working together to reach our community during this time. Thank you.
Good. Thank you, Vanessa. I'll invite you to stay on screen, and I will invite back Adriana, Corey, and Carlos for a panel conversation now. And I think I'm going to take the moderator's liberty to combine a little bit of panel conversation with a little bit of audience Q&A, because there have been a ton of questions, which is great. So let's go ahead and jump into it. And I think this first question I'll pose to Corey and Carlos we've talked a lot about certainly HR1 impacts on healthcare, on food access, and there are other impacts that we heard mentioned, but I wonder if there's any that you want to go back and revisit. And so, Corey, it looks like yes, I'll turn it over to you.
One thing that I didn't really get into during my presentation is the attacks on the ACA marketplace and Covered California subsidies. And as we know, Congress has failed to extend the increased subsidies that we saw during the pandemic, and many terrible final federal rules have been particularly punishing. So people are seeing their premiums skyrocket, and many folks have switched to bronze plans, which save on the premium, but dramatically increase on deductibles and co-payments. And the LA Times had an article just yesterday about 375,000 people having canceled or left their Covered California coverage in the first quarter of this year. And I think there had been a question also about what are the housing impacts of HR1. And there is an expansion of the low-income housing tax credit, which actually is intended to help build more affordable housing. So there are some very small carrots that have been baked into HR1 in that way, but it's still too early to see how that is going to play out.
Yeah, and I would only add, we're thinking a lot about downstream impacts on the rest of the safety net. If we can't implement HR1 responsibly, and the reality is the policy was designed, as I said, to push people off of benefits, disconnect people from basic meeting their basic needs. So we know that there will be downstream impacts no matter what. We're particularly worried about the potential increase in homelessness. So when folks have to choose between rent and food, there's clearly a relationship with unsheltered homelessness when folks don't have concrete supports. So we're very worried about that. We're also worried about increased involvement by families in the child welfare system because there's ample research that shows that when families don't have access to concrete supports like food and healthcare, it increases stressors at home to the degree that potentially, there are measurable increased and unnecessary involvement in the child welfare system and increased entries in the foster care system. So I think what we're trying to do as we implement HR1 in real time is to also not wait to bolster those other parts of the safety net now so that when we start to see those precipitating events unfold in 2 years or 3 years, we have a system that's prepared to take on those new individuals and families.
And if I could just add one more thing, there is a state law that says that counties must provide aid to their indigent residents. It's Welfare and Institutions Code 17,000. And that's what gave rise to a patchwork of county medically indigent programs we had before the Medi-Cal expansion. And I think the programs varied widely county to county. And it's an open question about what that law is going to mean when so many people are losing their health coverage. Is the burden being shifted to those county programs? What will that look like? Western Center has done a lot of litigation around that law and what's going to happen. And it's too soon to tell, but that's something there that is kind of lurking in the background. What will happen?
Good. Thank you both for that. Shifting a little bit, and Adriana, I'll invite you in. There were several questions that connected, obviously, around revenue and how do we sort of increase revenue in the state and then what's done with it. Some, I know you presented on closing corporate tax loopholes. There was a particular question which I want to address around sort of revising interest in Prop 13 and revisiting it. Is there anything you want to address or share?
Sure. Yeah, happy to speak to this. And I think everyone here is familiar. Prop 13 was approved by voters in the late 70s, which limits property taxes and restricts assessed property values and requires a 2/3 vote of the legislature for certain tax increases. And you all recall that there was an effort to reform this a few years back, and advocates are interested in continuing to reform Prop 13, particularly because the most recent effort, it came pretty close, if you all recall. So I think the matter at hand is the timing. The timing of any future proposal to amend Prop 13 is uncertain, and I think part of the reason for that is there's a risk of voter tax fatigue if there are too many tax or revenue measures appear on the ballot at the same time. So advocates are generally mindful about how and when these measures should be proposed and advanced.
Good, thank you for that. So another question that's come up that I'll combine a couple questions. Certainly what we've talked about here are direct impacts of HR1 and the May revise on cuts to particular populations and health coverage and food access. And we know other ways individuals will lose access to. There's also, though, maybe some of the unintended consequences around, for example, children living in families who parents may no longer be eligible, they may still be eligible for coverage, and how we navigate those. So this is a two-part question that Corey and Vanessa, I want to invite you in. Corey, one, there was sort of the question posed around, are you seeing anything in any of the Senate or Assembly budget proposals around addressing, again, some of these unintended or secondary issues that may arise from HR1 and the May revise around kids losing coverage because parents have lost coverage, even though they're still eligible, as an example. And then Vanessa, I'm just wondering how are you navigating this in the community, right? Where there's sort of this losses happening, cuts happening, but really helping educate community members, like there still are things that are in front of us to keep. So Corey, I'll turn to you on like the policy piece, and Vanessa, then I'll turn to you on the community and engagement piece.
It is a policy question, but it is also a kind of acculturation question. And this is what we saw with Health for All, the idea that if parents have health care, their children will be more likely to go to the doctor or comfortable. Parents will feel more comfortable bringing their kids to the doctor. We're still parsing out the Senate and Assembly budget proposals. Western Center has a number of bills that would mandate state coverage of people who are losing full scope coverage. I think that's one of the stopgap measures. But it's also something I think we as a community, and I would love to hear Vanessa speak more on this as well, are doing to make sure that people know as much as it can be how to access healthcare. We're in a very uncertain environment where we used to be able to say like getting healthcare was safe. And as we've seen ICE enforcements and changes in the federal rules about what are safe spaces and safe locations, a lot of that is very sadly still up in the air.
Yeah, thank you so much. I really appreciate the question, Bonnie, and thank you, Corey, for expanding on how we would, in a way, support and mitigate these policy changes, specifically on work requirements to an already vulnerable, low-wage sector population that usually is beneficiary of Medi-Cal, and what these impositions of work requirements would signify for our community. Right now, what the efforts that are underway for all our health navigators that are in the space and promotores and enrollers who do all the renewals day by day, they're doing renewal fairs. So one of the best things is to just get out there. Renewal fairs or just information sessions. We're thinking of doing forums in the future that will, as the policies roll out, what does it signify? How can we support you? The renewal fairs right now are in clinics so that we can access the portals. If folks have an email address, most of these populations from what we're working with don't have email addresses. So we're doing as well the paperwork on site, and so that folks are able to access this information, not get dropped off of Medi-Cal. Everything that's being brought in paperwork as explicitly written in the threshold languages is not comprehensive enough for many communities. The link, sorry, I have an automatic light that doesn't allow me to. So the renewal notices right now, we're sending out social media messages. We're doing our ethnic media through our indigenous radio station in indigenous languages to get out the message that we're here when a letter arrives on Medi-Cal. We're here to read it for you, to help you respond to it. And also we're doing anything that needs to be sent out back to Medi-Cal in order to say, submit your comprobantes, or like, I am working, here are my pay stubs. If an individual can't come because they're working and they still have to pick up their children and still have to go home and cook, you can text us your pay stuff, and we will PDF it. We will file everything for you so that you're not left behind. And so it's essential that we meet community where they're at. It's essential that we create systems that are not as complicated as it is set up already to be. There is these portals are really, amazing to folks who might like have the digital literacy, but the reality is that most Californians, digital literacy is still, a barrier for many. And so now is an opportune time to create more education and outreach, especially with the work-in positions for us. At least what we're looking through is what would it look like to mitigate it through if somebody's not able because of seasonal work and the farm work, what can they do to volunteer their work? How would organizations who need to help support individuals who speak different languages, who need to attest and say, these are my 80 hours that I'm required to give back. And so we're working, I think, right now with the state to see what would it look like for us to be an agency that can document that, but also not create more barriers for our community. I also want to highlight that, when we talk about reaching healthcare and mental health services, we also have programs that are supported through the state, through our public health system and our behavioral health systems. But those are under threat through new changes in a way through the BHSA, MHSA transition from Prop 1. And we need to keep programs like this alive. For example, we have a program called Living with Love and one called Healing the Community, where the services are free of charge to Indigenous communities. Any of these services where they're handed hierbas or medicinal plants as a form of therapy, anywhere else in the Western world would be like $100 or $200 a session. But here, we're able to mitigate the impacts of mental health by offering it for free in a safe and trusted environment. So it's going to take a lot of work. It's going to get double, triple the work for organizations to mitigate these policies as they start implemented and roll out, each of them through the HR 1 impact.
Good. Thank you both for that. So wanted to pose a question because it's live now, right? As we saw earlier this week, the interim final rule and guidance from CMS on work requirements came out, and particularly the medical frailty exemption. I wonder if any of you want to share or speak to sort of help us understand the magnitude, if you can, of what this means, and how are folks organizing at a local level or state level to really mitigate these coverage issues.
Yeah. Oh, do you want to start, Corey?
No, go ahead.
I think that it's such an important question because what we are able to do as a state when it comes to exempting people on the basis of medical frailty in Medi-Cal will ultimately determine how many people drop off, right? And how many people are ultimately shielded from these unnecessary procedural hurdles. The Department of Healthcare Services has been very thoughtful, as I shared earlier, with regard to their implementation plan. They based their implementation plan largely on a set of state flexibilities, assumptions that ultimately would reduce the administrative burden on workers and clients alike, to the extent that we could potentially exempt these folks on the basis of medical frailty. So if there exists already data within our administrative data systems that would allow someone based on their medical history, claims data, diagnostic codes, and the like, to ultimately qualify for a medical frailty exemption, that would happen automatically in DHCS's plan. To the extent that someone might not have a doctor's note, but they could you know, essentially they would have to sign for it, but they could self-attest to a condition that they're managing and that we could verify later. The implementation plan was built on that type of flexibility. And so what we're seeing with CMS's rule is a much more strict application of those options, which we're concerned about. The rule introduces a raft of new verifications that would have to be paired with the use of diagnostic codes and self-attestation, and also limited timelines, windows within which they could apply. So, whereas we would have hoped that once you have certain diagnostic information or self-attestation, you could ultimately use that to exempt on an ongoing basis, the rule appears to restrict that to a time limited. So what we're seeing from the feds is they're introducing a whole host of new administrative requirements in order to use these. And what it's going to result in is an increase in workload and an increase in complexity. So we are very concerned with the outcome that we've seen this week.
And I just want to add to the question about what are people doing about this and many other things that are coming out in the final rules or the implementation of HR 1 and eventually the implementation of whatever the budget the legislature passes and the governor signs. Organizations like Western Center and the National Health Law Program, together with the Health Consumer Alliance, have a monthly call for health advocates. And from there, we gather information about what people are seeing in the field and how we can work directly with the state agencies to stop harms, to mitigate harms, to make sure that the rollout of certain features are informed by community. And so I think I will put some information that's going to go out with the materials about how to join those calls so that you can voice your concerns and have them be included, or find out how to plug in with advocacy efforts that are happening every month with CDSS and DHCS.
Good, thank you, Corey. And we can make sure too that all those also go in the follow-up materials as well. There have been so many terrific questions, and we have also come to the end of the program. So I want to thank Adriana, Corey, Carlos, and Vanessa for your insights, the helpful information you shared with our audience, and this very, very rich conversation. And our appreciations to each of you for joining this program today and the work you're doing to support the health and well-being of Californians and our communities. Thanks again for joining us today. There's a lot here to digest and a lot of work ahead. The California Endowment remains committed to working alongside our partners, community organizations, advocates, and public institutions to advance health equity across the state. As a reminder, a recording of this webinar and related materials, including slides and bios, will be shared with all registrants in the next day or two. Lastly, we welcome your feedback. Please take a moment to fill out the survey link in the chat or scan the QR code on your screen. Let us know your thoughts on today's program and what topics we should cover in the future. Thank you again, and I hope to see you all at the next Policy Perspectives webinar. This concludes our program.